Good evening. My name's Alison Jukes. I'm a feline internal medicine specialist working at Cat Specialist Services in Brisbane, Australia. And this evening, we're going to have a talk about feline infectious peritonitis. And the goal of the talk today really is to improve understanding of this disease, also improve our understanding of different diagnostic tests that we can perform so that we can obtain a diagnosis of this disease, and then we shall have a look at different treatments available as well. So as a bit of an overview, in the first part of the talk, we'll discuss FIP, pathogenesis and pathophysiology. Then we'll talk about how we obtain a diagnosis looking at our patient overall from signalment to laboratory testing and more specific testing for FIP and feline coronavirus. In our part 3 of the talk, we will go specifically through cases of cats with a diagnosis of feline infectious peritonitis, as well as some cases which looked like feline infectious peritonitis, but were actually other different disease processes. And then our last part of the talk, we will have a look at the updates on feline infectious peritonitis treatment, with a particular focus on some of the newer antivirals that are available to us. So, starting off with FIP pathogenesis and pathophysiology, and I'm quite passionate about understanding disease process and how different diseases occur and what they do to our patients. If we can understand the pathogenesis and the pathophysiology of disease really well, then it can help us understand why our cases present with the clinical signs and laboratory changes that they do, and it will make all of us better clinicians. So we'll start here. And so, as I'm sure we all know, when we're talking about feline infectious peritonitis, the causative agent of this disease is feline coronavirus. And feline coronavirus is an RNA virus. It is present in cats worldwide. And when we have a patient infected with feline coronavirus, it typically will cause pretty mild disease, but if we have a patient in which they develop FIP, then this disease is uniformly fatal unless treated. When we're considering cats with FIP, the most commonly affected cats are pedigree cats and young cats less than 2 years of age. The disease itself is commonly described as a wet form versus a dry form. A wet form is where we see effusions, commonly pleural or abdominal effusion, sometimes